Bismillahirrahmanirrahim. This is Dr. Hooria Aamir. I welcome all my students to today's lecture regarding the secretions of saliva. Now, we are going to learn about how it is produced, what are its functions, why it is important. So, we'll be doing it one after the other. Now, what is saliva? Now, saliva contains a serous secretion and a mucus secretion. The principal glands of salivation are the parotid, submandibular, and sublingual glands. There are many tiny buccal glands. Daily secretion of saliva normally ranges between 800 and 1500 ml. The average value of saliva production per day, that is around 1 liter, and what is it? That is 1000 milliliters per day. Now, saliva contains two major types of proteins. Now, first is the serous secretion, and the other one, that is the mucus secretion. A serous secretion that contains ptyalin and alpha amylase, which is an enzyme for digesting starches. Mucus secretion that contains mucin for lubricating and for surface protective purposes. C. There is presence of different salivary glands in close vicinity to the mouth. You can see the parotid gland, accessory parotid gland, submandibular gland, sublingual gland, and they have opening inside the mouth. The parotid glands, they secrete almost entirely the serous type of secretion, whereas the submandibular and sublingual glands, they secrete both the serous secretion and mucus. The buccal glands, they secrete only the mucus. Now, saliva has a pH between that of 6 and 7, a favorable range for the digestive action of ptyalin or alpha amylase. C. The daily production of different intestinal juices along with that of saliva. So, daily secretion chart of gut secretions is important to learn. And what is the favorable pH at which they are acting, like saliva? C. That is daily about 1 liter production, and it is active like favorable pH is 6 to 7. Total, if we see all the juices, there is production of about 6.7 liters of the intestinal juices per day. Secretion of ions in saliva. Saliva contains especially large quantities of potassium and bicarbonate ions. Conversely, the secretion of both sodium and chloride, they are several times less in saliva than in plasma. So we should be knowing about it. The submandibular gland, a typical compound gland which contains acini and salivary ducts. The salivary secretion is a two-stage operation. The first stage involves the acini, and the second, the salivary glands, the ducts. The acini, they secrete the primary secretions that contain ptyalin or mucin in a solution of ions. See how there is production of secretions going on. As the primary secretion flows through the ducts, two major active transport processes that take place that markedly notify or modify the ionic composition of the fluid in the saliva. The first, sodium ions, they are actively reabsorbed from all the salivary ducts, and the potassium ions, they are actively secreted in exchange for sodium. See, the primary secretion is that of production of ptyalin, mucus, extracellular fluid, and then there is sodium active absorption, chloride passive absorption, potassium active secretion, and bicarbonate secretion. The sodium ion concentration of the saliva becomes greatly reduced, whereas the potassium ion concentration becomes increased. However, there is excess of sodium reabsorption over potassium secretion, and this creates electrical negativity of about minus 70 millivolts in the salivary ducts. This in turn causes chloride ions to be reabsorbed passively. The chloride ion concentration in the salivary fluid falls to a very low level, matching the ductal decrease in sodium ion concentration. Second, bicarbonate ions, they are being secreted by the ductal epithelium into the lumen of the duct. This is at least partly caused by passive exchange of bicarbonate for chloride ions, but it may also result partly from an active secretory process. The net result of these transport processes is that under resting conditions, the concentrations of sodium and chloride ions in the saliva are only about 15 milliequivalents per liter each, about 1/7 to 1/10 their concentration in plasma. Conversely, the concentration of potassium ions is about 30 milliequivalents per liter, 7 times as great as in plasma, and the concentration of bicarbonate ions is 50 to 70 milliequivalents per liter, about 2 to 3 times that of plasma. See the composition of saliva, the level of potassium, chloride, bicarbonate, sodium in plasma, in saliva, you can see. During the maximal salivation, the salivary ionic concentrations change considerably because the rate of formation of primary secretion by the SNI can increase as much as 20-fold. When copious quantities of saliva they are being secreted, the sodium chloride concentration is about 1/2 or 2/3 that of plasma, and the potassium concentration rises to only 4 times that of plasma. Now the functions of saliva. The first one is the oral hygiene. Under basal awake conditions, about 0.5 liters or 0.5 ml of saliva almost entirely 0.5 ml of saliva, almost entirely of mucus type, is secreted each minute. But during sleep, little secretion occurs. This secretion plays an important role for maintaining healthy oral tissues. The mouth is loaded with pathogenic bacteria that can easily destroy tissues and then can lead to even dental caries. And the saliva helps to prevent the deteriorative processes in several ways. First, the flow of saliva itself is going to wash away the pathogenic bacteria as well as food particles. Second, the saliva is containing several factors to destroy the bacteria. One of them is the thiocyanate ions and another important proteolytic enzyme, that is the lysozyme, that is going to actually attack the bacteria, that is going to aid the thiocyanate ions in entering the bacteria, where these ions in turn they become bactericidal. Digest the food particles, thus helping further to remove the bacterial metabolic support. Third is the saliva often contains significant amounts of protein antibodies that can destroy oral bacteria, including some that cause dental caries. In the absence of salivation, oral tissues often become ulcerated and otherwise infected, and caries of the teeth can become rampant. See, The salivatory nuclei, they are located approximately at the juncture of medulla and pons, and they are excited by both the taste and tactile stimuli from the tongue and other areas of mouth and pharynx. Many taste stimuli, especially the sour taste caused by acids, elicit copious secretion of saliva, often 8 to 20 times the basal rate of secretion. Also, certain tactile stimuli, such as the presence of smooth objects in mouth like a pebble, cause marked salivation. Of rough objects cause less salivation and occasionally even inhibit salivation. Salivation can also be stimulated or inhibited by nervous signals arriving in the salivatory nuclei from the higher centers of the central nervous system. For instance, when a person smells or eats favorite foods, salivation is greater than when disliked food is smelled or eaten. The appetite area of the brain, which partially regulates these effects, is located in proximity to parasympathetic centers of anterior hypothalamus, and it functions to a great extent in response to signals from the taste and smell areas of cerebral cortex or amygdala. Salivation also occurs in response to reflexes which are originating in stomach and upper small intestines, particularly when irritating foods they are being swallowed. When a person is nauseated because of some gastrointestinal abnormality, the saliva, when swallowed, helps to remove the irritating factor in the gut by diluting or neutralizing the irritant substances. The sympathetic stimulation can also increase salivation a slight amount, much less so than does parasympathetic stimulation. The sympathetic nerves originate from the superior cervical ganglia and travel along the surfaces of the blood vessel walls to the salivary glands. A secondary factor that also affects salivary secretion is the blood supply to the glands, because secretion always requires adequate nutrients from the blood. The parasympathetic nerve signals that induce copious salivation also moderately dilate the blood vessels. In addition, salivation itself directly dilates the blood vessels, thus providing increased salivatory gland nutrition as needed by the secreting cells. Part of this additional vasodilator effect is caused by kallikrein secreted by the activated salivary cells, which in turn acts as an enzyme to split one of the blood proteins, an alpha-2 globulin, to form bradykinin, a strong vasodilator. Esophageal secretions. The esophageal secretions, they are entirely mucus. Their function is actually to provide the lubrication for swallowing. The main body of esophagus is lined with many simple mucus glands. At the gastric end and to a lesser extent in the initial portion of the esophagus, there are also many compound mucus glands. The mucus secreted by the compound glands in the upper esophagus prevents mucosal excoriation by newly entering food. The compound glands located near the esophagogastric junction protect the esophageal wall from digestive functions of the acid gastric juices that often reflux from the stomach back into the lower esophagus. Despite this protection, a peptic ulcer at this time can still occur at the gastric end of the esophagus. So this is all about today's lecture, and I hope you'll all be understanding it and revising it at homes. So stay blessed and Allah Hafiz.